All right, let's dive in. Today, we're tackling a question that's been around forever. What does it even mean to be normal? We're going to go on a wild journey, from ancient skulls all the way to modern science, to figure out how we even begin to talk about psychological disorders.
So, let me ask you something. Have you ever looked at someone, or maybe even yourself, and thought, is that normal? I mean, where is the line between just being a little quirky and having a real problem? It sounds like a simple question, but trust me, it's one of the trickiest in all of psychology.
And that's really our first big idea here. This line we're trying to find, it's not set in stone. The idea of what's normal is actually a moving target that's been shifting around for centuries.
I mean, think about it. Who gets to decide what counts as abnormal? Is it doctors? Society? And has that definition always been the same? The answer to that is a huge, resounding no. And how that definition has changed over time has had some really serious consequences for people. So to really get a grip on where we are today, we've got to take a quick trip back in time. Because the ways we've tried to explain abnormal behavior in the past, well, they're fascinating and honestly, sometimes pretty disturbing. For a huge chunk of human history, if someone was acting strangely, the explanation was basically supernatural. We're talking evil spirits. Then, the ancient Greeks, guys like Hippocrates, came along and had a more biological idea, but they thought it was all about your body fluids, or humors, being out of whack. Fast forward to the Middle Ages, and we're right back to demonic possession and exorcisms. And then, get this, during the Renaissance, some of the very same behaviors could get you accused of witchcraft. It's a crazy time.
And wow, this image is a powerful reminder of just how differently people used to think. You're looking at skulls with holes drilled right into them. This was a procedure called trephining, and the idea was literally to give the evil spirits an escape route. It's a really chilling look into a completely different view of the human mind.
Thankfully, things are a lot different now. Today, we use what's called a medical model. We treat psychological disorders like other illnesses. So we try to make a diagnosis, figure out the cause, track how it develops over time, and predict the likely outcome, or prognosis. It's much more systematic.
So, how does this medical model actually work in the real world? That brings us to the modern way of thinking, the framework that professionals use to define and explain what a psychological disorder actually is. Well, professionals often use a handy checklist known as the 4Ds. First, is the behavior deviant, as in way outside of social norms? Second, is it causing the person significant distress or emotional pain? Third, is it dysfunctional? Is it getting in the way of their daily life? And finally, does it pose a danger to themselves or to other people? Generally, you have to hit at least 2 of these for it to be considered a disorder. Okay, so when it comes to why these things happen, there are a few big ideas. The first is the biological model. This one says the problem is physical. It's about your brain chemistry, your genes, the actual structure of your brain. You can kind of think of it as a hardware problem. And this image pretty much sums it up, right? The biological model puts the brain front and center. It looks at psychological disorders as a disease of a physical organ, just like we would with heart disease or diabetes. But of course, biology isn't the whole story. You also have psychological models, which focus more on the software, if you will. The psychodynamic view, for instance, looks at unresolved conflicts from your past. Behaviorism says, nope, these are just learned habits. And then the cognitive perspective says it's all about your patterns of thinking, your irrational beliefs. This image of a brain as a puzzle is the perfect way to picture it. These models see the mind as this incredibly complex system where our thoughts, our memories, and our habits all have to fit together. And sometimes, the way those pieces are connected can cause real problems. So, who's right? Is it a hardware problem or a software problem? Well, the most current thinking is that they all play a part. This is called the biopsychosocial perspective, and it basically throws everything into the mix: your biology, your own personal psychology, and even your social and cultural environment. It's the whole shebang, and it's the most complete picture we have. Okay, so with all these different factors, how on earth do doctors and therapists stay on the same page? Well, they have a handbook, a super important tool that gives them a common language for diagnosis. In the US, that handbook is the DSM, which stands for the Diagnostic and Statistical Manual of Mental Disorders. Now, what's really important to know is that the DSM doesn't tell you the cause of a disorder. What it does is give very specific checklists of symptoms so that 2 different doctors in 2 different states can look at the same patient and come to a consistent diagnosis. So just how many disorders are in this book? Get this, around 300.
That number alone should give you a sense of just how complex the world of mental health really is. All right, now that we've covered how we define and classify these things, let's talk about the reality of it. Because this stuff isn't rare. It's a huge part of the human experience, and the numbers, well, they might just shock you.
Check this out. According to data from 2021, nearly 23% of adults in the US had a mental illness that year. That's more than 1 in every 5 people. Just let that sink in for a second. This is not some fringe issue. It's an everyday reality for millions and millions of people.
And this table breaks it down even more. You can see anxiety disorders are at the top of the list, affecting over 19% of adults every single year. Depressive and bipolar disorders are nearly 10%, and even disorders that we might think of as super rare, like schizophrenia, still affect hundreds of thousands of people. It really just boils down to this simple but incredibly powerful statement from our source material. Psychological disorders are not uncommon. That's the core truth we all need to start with.
So I'll leave you with this final thought to chew on. If these conditions are so widespread, if they're affecting our friends, our family, our coworkers, maybe even us, how should that change the way we talk about mental health? How do we finally move away from stigma and toward genuine support? That's the real question for all of us.